I'm going to show you the absolute best, most effective way to use a foam roller. But before I show you this technique, I need to talk to you about why it works. It works because it addresses your fascia. Your fascia is a big layer of cling wrap that's all around your body, goes all around your muscles, in between your muscle fibers, in between your muscle fibrils, nerves, wraps around nerves, blood vessels. It really is a big spider web all over your body, and it has been implicated in all kinds of physical pain and injuries. So when it's unhealthy, it doesn't glide appropriately. And when it doesn't glide, different layers don't glide appropriately, muscles aren't able to contract the way they optimally would. This affects your ligaments, your tendons, your bones even. So how can we tell if fascia is unhealthy? Well, one way we can tell is by using ultrasound. And ultrasound images are able to detect adhesions type materials in the fascial layers. But an even easier way to do that you can do on your own is by applying compression and testing if that compression is painful. So there could be other areas that are painful in your body, such as if you have a strain or a bruise. But let's suppose some area doesn't have that strain, and you apply compression. Here's an example of how I would apply compression to my layer of fascia around my quads. I would lie on the foam roller and I would put all my body weight on that spot. If that area is painful, that's a sign that fascia is unhealthy. So what to do about it? Well, the way that you're going to use this foam roller to create a healthy fluid flow in your fascial layers and thereby improve how your muscles function and improve conditions potentially of your tendons and ligaments is to apply that compression and at the same time create a shear force. How to do that is by movement. So here's an example of how I would compress the fascial layers around my quads and then create a shear movement. So I'm compressing, and now I'm going to move my legs side to side and forward and back. If that area was tender, you might have noticed there might be some clunks and a release, a sense of release. That's a sign that you're getting the fascia to be healthy.